So what do you do if your patient has an aneurysm? And what is an aneurysm? Well, with this mnemonic, we're going to help you figure that out. So the mnemonic we're going to look at today is called CRAM. And what we're looking at here is how you can therapeutically manage your patients with any sort of aneurysm. First, let's look at what an aneurysm is. Well, an aneurysm, particularly here, is the one that we're dealing with the aorta. The aorta is the largest artery in the body, and it's under a lot of pressure all the time. An aneurysm is a weakening in this wall of the artery, and what happens is that under this pressure of usually hypertension, this wall starts to balloon out and it has the potential to rupture. So what do we do for these patients? Well, we use this mnemonic called CRAM. C stands for color or cap refill. Every time we take a look at our patients, if they're at risk for an aneurysm, we're looking to make sure their cap refill is good and to make sure they're not turning blue or having any sort of other issues. R stands for reduce blood pressure. The main thing that you want to focus on when you're dealing with an aneurysm is reducing the patient's overall blood pressure and making sure that that's okay. A stands for assess peripheral pulses. Well, what happens when the artery ruptures? Now you don't have any sort of perfusion or blood flow out to those peripheral extremities. So what you want to do is you want to continually check your patient's pulses, either in their wrists or in their feet. M stands for monitor kidney functions and values. Why? Why do we do that? Well, the thing that we want to remember is that the kidneys are important in regulating blood pressure. So if they're not getting the necessary blood and oxygen that they need to become perfused, then we have a major problem, and this is terrible snowball effect. Now, when you're dealing with your patients that are having that aneurysm, or you're suspicious that they have an aneurysm and you want to therapeutically manage it, remember to use the mnemonic CRAM. Now go out and be your best selves today, and as always, happy nursing.